England has reduced the minimum self-isolation period for COVID-infected patients to 5 days. It comes after a review of the medical evidence and is partly designed to ease staff shortages across the economy. People who test positive will need to produce a negative lateral flow test after 5 and 6 days of isolation to be released from quarantine. Just last month, England reduced the isolation period from 10 days to 7 days. The UK's Health Security Agency says 2/3 of positive cases are no longer infectious by day 5. The United Kingdom's also introduced booster jabs for 16 and 17-year-olds. Initially, invitations will be sent out to about 40,000 teenagers who've had their second doses at least 3 months ago. Meanwhile, Scotland has lifted restrictions for outdoor events, which means large outdoor public gatherings can take place again with crowds, including football matches. And we can join our correspondent Giles Gibson now, who's with us live from London. Giles, talk to us about that reducing of the isolation period. Why was the government so keen to bring that down?
Well, the UK Health Secretary Sajid Javid has said that cutting the isolation period down to at least 5 days is going to reduce pressure on essential public services over the course of the winter. Of course, Ollie, we've seen the National Health Service as well as public transport services such as train companies having to cancel hundreds of services simply because they can't get enough staff to man those trains, and other parts of the economy as well, really just struggling with getting enough staff with so many people getting infected with COVID-19 during this Omicron surge and then having to self-isolate at home. Worth reiterating here that this rule change is just for England. The previous rules remain in place in Scotland and Northern Ireland and Wales. The local authorities there have been much more cautious about the way that they have handled this Omicron surge since December. And Ollie, the central tension here is this question about, yes, reducing the isolation period could certainly ease staff shortages for things like the NHS and train operators in the short term. The question is, of course, in the medium and the longer term, whether getting more people back out into the community earlier on after they have tested positive for COVID-19, whether that is potentially going to drive up case numbers here in the UK once again. The UK government seem confident that that scenario is not going to play out.
Well, on a related point, Giles, the so-called Plan B measures which are in place at the moment, like working from home guidance and masks in shops, are those likely to be eased soon?
Well, the key date here is the 26th of January. That is the first date at which UK Prime Minister Boris Johnson could decide to lift some of these Plan B restrictions, as they're known. That's things like the working at home guidance. There are some reports in the UK media that the Prime Minister could lift some of those, but also decide to keep some of the masking rules in place or tinker with the masking rules in public. Of course, the UK government are going to be watching a couple of data points really clearly as they try to make this decision. Firstly, of course, just the number of cases. We saw approximately 71,000 new cases of COVID-19 identified on Sunday. That compares to 140,000, roughly double the Sunday beforehand. And there are certainly already signs that the UK has reached the peak of this Omicron surge. But the key piece of data that UK Prime Minister Boris Johnson and the UK government keep talking about when they talk about bringing in restrictions or taking away restrictions is the number of hospitalisations here in the UK. And just in the last few days or so, they've been flat really for the last week or so. But just in the last few days or so, there have been signs that the number of people in hospital with COVID-19 is starting to fall as well. And that is certainly going to be a key piece of data as UK Prime Minister Boris Johnson considers whether to pull back some of these restrictions again.
OK, Giles, thanks.